now I wanted also to talk about what is the state of affairs now for medicine right now, and what is it what we call allopathic medicine, and what is what we call alternative medicine. And it's often thought that allopathy is modern medicine, but as the way I understand it, allopathy is just as old as complementary medicine. It's just as old, and the difference is just there were always people who had a very limited way of looking at things. This is allopathy, and then there's another group of people who are having a more holistic, a more many-sided, a more many-dimensional view of things, and this is the complementary medicine. So of course there are always more people who are having a limited view of things, so that there was always a greater number of people who were believers and practitioners of allopathy. And there's but this is maybe a new thing for many people, that allopathy was around all the time, just as there was always complementary or holistic medicine. So what is for me the basic principles of allopathy? Well, the number one principle, which is a very great limitation of thinking, is that one remedy does the same thing in everyone you give this remedy. So usually people who are more in an allopathic mode of mind, they ask, what kind of remedy should we give for this kind of person, in this for this kind of disease? And they believe there should be one remedy for any kind of person having this kind of disease. So that's the number one limitation in allopathic thinking. And of course this is clearly shown not to be the case in systems like homeopathy. There you see that every disease is really having a very unique expression in every person, in every different person. So in fact, I would go as far as to the point to say there is no disease in itself. I call disease names, I call them house numbers. So of course most people, when they come in contact with our system, first they ask, what can I do for this disease, and what can I do for that disease? And I always answer, disease names are house numbers for me. So the same case would be, for example, somebody selling carpets, and he asks me, what kind of promotion should I use at this kind of house number? In what way should I talk to the people who live at this house? And that's just as nonsense, just as nonsensical, because it's really not the house number which counts, it's the people who live there. And the same is with diseases, it's not the disease name people have, but the people who express the disease. So I would go even as far as homeopathy. In homeopathy there are no disease names really, there's only symptoms. So in homeopathy they went one step further, and this was like the invention of Hahnemann, basically almost 200 years ago, that he was against using any disease names, but just making a repertory of the symptoms somebody expresses, and then finding a matching remedy which also has expressed this kind of symptoms in his testing. So he was against making all kind of theories about diseases, where disease comes from, why this disease is there. Like today we have certain diseases where we say a bacteria is the cause, or a virus is the cause, or a fungus is the cause, or some electromagnetic pollution is the cause, or some let's say chemicals in the environment are the cause. So we all make those cause and effect relationships which are very much against thinking in terms of homeopathy. And but they were always in the line of what I always call allopathic thinking, the cause and effect thinking. A disease is based on one or two causes, but with homeopathy, and that's a holistic way of thinking, we're not even trying to find the cause, but we try to find solutions. So that's the other aspect of holistic thinking, which was always around, and which I now introduce into our system. To look for solutions is to basically describe the person's situation in the most holistic way. So what does this mean? It means not only his the biochemicals in his body. This is what modern medicine or allopathy looks at this point. When you do a lab analysis, you look at how are the neuropeptides, how are the hormones, how are maybe the pH level, and so on. How are the biochemicals? And from this, we've tried to diagnose. We try to find a reason why somebody is the way he is. But this is a very limited way again, and it's based on substance.